Hello again. One of the most baffling aspects of modern life is the way in which we are called upon to give lip service to the idea that there are no essential differences between men and women. Most people know about these differences, but dare not speak about them for fear of losing their jobs, being denounced in the newspapers, or even ending up under arrest. Because of this, a small number of militants feel able to force people to do and say the most extraordinary and completely mad things. Part of this is, of course, the result of a laudable desire not to upset people who wish to change sex. Now, it is, of course, nothing to me if a man wishes to dress as a woman, or vice versa, or for anybody to take hormones, undergo surgery, or anything else. Good luck to such people, it's certainly no business of mine. However, when nurses being trained as midwives are advised that they may encounter a birthing person who has a prostate gland and will need special attention being given to the scrotal area during the process of giving birth, I feel I must object. If any member of my family is having a baby, I want the midwife present to have been trained in real human anatomy, not stuff relating to humans with a prostate gland giving birth, or anything to do with unicorns, dragons, mermaids, or any other imaginary creatures. I would rather that they spent all their time learning about the real world so that they know what they're doing. At Edinburgh Napier University, which is very up-to-date and modern, midwifery students are told that you need to be familiar with the catheterization procedure for both male and female anatomy. For this reason, where appropriate, this book refers to the birthing person. Then the guide goes on to say that male persons should be warned of discomfort as the deflated balloon passes through the prostate gland. This is absolutely raving mad. Nobody with a prostate gland has ever, in the history of the world, given birth. This is because only biological males have such a thing and they cannot have babies. Even if a biological female undergoes sex change surgery, this will not mean the acquisition of a prostate gland. Sorry girls, this is purely a male part of the anatomy. We have to ask ourselves why a medical school should be publishing stuff like this, which is completely untrue and impossible. The answer is that in their desire not to upset transsexuals, they have decided to pretend that biological males can actually have babies. In other words, they have wandered into the realm of fantasy. Hands up, anybody in the audience who is happy about a medical school dealing with stuff in the realm of fantasy rather than the basic facts of human anatomy. All this goes hand in hand with the increasing use of expressions such as chest feeding, which is a preferred term among sensitive and with it members of the medical profession for what the rest of us call breastfeeding. The University of Manchester has a guide to inclusive language which suggests that students and staff should avoid using the words mother and father, replacing them with parent or guardian. Google are in on this game as well now. Their assistive writing tool will alert writers if their language is not inclusive. Those trying out the new application soon found that it flagged up motherboard as being a little suspect, and suggested that writers might want to look for a more inclusive term, such as parent. I'm not sure that this is going to catch on with the computer industry and that they'll stop talking about motherboards, but still. As I say, I'm all in favour of being sensitive to other people and avoiding saying or doing things which might cause distress. But I cannot really start pretending that somebody with a prostate gland can have a baby. This is a step too far. I tend to let others get on with their lives as seems good to them in general, but this kind of thing makes life dangerous for the rest of us, particularly those giving birth. If midwives are spending their time learning about how to take care of the scrotal area of somebody giving birth and worrying about causing discomfort to the prostate gland of pregnant men, then they might not be devoting enough of their time to studying about the real situations which they might encounter, say, during a difficult pregnancy.